Director, Mr. Major General Manoj Kumar Bindal Sahab is also here. ED Sahab, good morning. ED sir. So शुरू कर सकते हैं फातिमा?
Yes, sir. All the panelists have joined, so we can start the webinar.
Meanwhile, I'll make a call to Mr. Bindal. Good morning, sir. Join करना sir. अच्छा, आ जाइए. हाँ, सर.
Good morning, Dr. How are you?
Good morning. How are you, General Bindal?
Very fine.
Namaste.
Thank you. Namaste.
Good to see you.
Good to see you
It's
too.
getting cold and cold, huh?
Yes. And next 2-3 days will be much colder.
I hear that there's going to be rain next Monday, Tuesday.
Yeah,
Okay.
it's likely.
There's some northwesterly disturbance coming down.
Yeah.
But the COVID is getting better, no? So that's a better news.
So do we require the vaccine now? With COVID getting
Well, let us have it.
better?
As we are talking about, preparedness, so it's always good to have that.
Yeah, that's true. Yeah. So, Fatima, शुरू करें.
Sorry, sir. So I welcome you all on the webinar on food and nutrition risk and disasters, lessons from COVID-19 perspective. So let's just give a brief introduction of the program. It's actually about the disasters that are because of food and occurs when food and nutrition there is a difference in food and nutrition. It's occurrence of in the recent decades resembling the large number of affected communities and their resources, including food and health. The COVID-19 pandemic has led to the dramatic loss of human life worldwide and presents an unpredicted change to public health, food system, and the world health program. Therefore, we must rethink the future of environment and tackle climate change and environmental degradation in the ambiguation of urgency. So, for the program to be started, I welcome our Executive Director, Mr. Manoj Kumar Bindal, sir. Just a moment, sir. Sorry, sir. Yes, sir. So he is the present executive director of NIDM. He commanded in air defense regiment and in an air defense brigade in the Kashmir region against the backdrop of country insurgency operations. He has been the staff and the mountain brigade developed in the country insurgency OPs and the high altitude areas in armor division deployed in the plains, the desert corps, and in the Corps HQ in the high altitude areas. He has also been posted as a Deputy Director General in Director of Army Air Defense. He also served as a Provost Master in the United National Missions in the Mozambique. He has been the Director Center for the United Nations Peacekeeping CUNPK New Delhi. Major General Manoj Kumar Bindal sir, please give us the welcome address to the panelists. Hello.
It's for me to start now?
Yes, sir. You just give a welcome address of the webinar.
Okay. First of all, I welcome all the esteemed dignitaries who have come to address this seminar, and also the participants joined on such an important issue, which is generally not talked about much in the disaster management scenario. So this particular webinar is aimed to throw a light on the food and nutritional risk and disasters, so that it is given the right impetus in the coming months and years. We are all aware that COVID-19 pandemic that has spread rapidly and extensively around the world since late 2019 has had profound implications for food and security nutrition. The unfolding crisis has affected food systems and threatened people access to food via multiple dynamics. We have witnessed not only a major disruption of food supply chains in the wake of lockdowns triggered by the global health crisis, but also a major global economic slowdown. These crises have resulted in lower incomes and higher prices of some foods, putting food out of reach for many and undermining the right to food and stalling efforts to meet the Sustainable Development Goals SDG 2, which talks about zero hunger. The situation is fluid and dynamic and characterized by a high degree of uncertainty. According to the World Health Organization, the worst effects are yet to come. Most health analysts predict that this virus will continue to circulate for at least 1 or 2 more years. So the food security and nutrition risks of these dynamics are very, very serious. And already after the outbreak of the pandemic, according to the latest State of Food Security and Nutrition report from FAO, some 2 billion people faced food security at a moderate or severe level. Since 2000, these numbers have been climbing at an alarming rate of 60 million over 5 years. Pandemic is undermining efforts to achieve the SDG. The complex dynamics triggered by the lockdown intended to contain the disease are creating conditions for a major disruption of food systems, giving rise to a dramatic increase in hunger index. Most recent estimates indicate that between 83 to 132 million people, including 38 to 80 million people in low-income countries that rely on food imports, will experience food insecurity as a direct result of the pandemic. At least 25 countries, including Lebanon, Yemen, South Sudan, they are at risk of significant food security deterioration because of the secondary socio-economic impacts of the pandemic. In Latin America, the number of people requiring food assistance has almost tripled in 2020. Food productivity could also be affected in the future, especially if the virus is not contained and the lockdown measures continue. It is vital that the Global Committee continue to monitor the situation closely, respond in necessary ways to avert outcomes with respect to food security and nutrition, and carefully consider how to build resilient food systems and ensure right to food in order to achieve the Sustainable Development Goal number 2. Nutrition security is often compromised during emergency situations, and hence immediate response is required to ensure that affected people in the communities have access to adequate food during times such as this. In this scenario, food and nutrition security assessment should be done. The objective should be to determine the magnitude of the problem pertaining to food and nutrition in the population that is affected by the emergency situation. More specifically, it helps to address some basic questions like what are the food and nutrition needs, who is the most vulnerable population, how to implement their interventions. So it should be noted that disaster assessment is the collection and analysis of information pertinent to disasters, disaster risks, and disaster response interventions. In this case, the assessment starts from pre-disaster preparedness and warning phase through the emergency phase, the rehabilitation and recovery, assessing the impacts on the community, their assets, crops, livestock, and their livelihood. And as the need of the community changes through these phases, the specific objective of the ongoing assessments change as well. The food and nutrition sector also contribute to other diverse sectors like the livelihoods, the protection of children, gender, and other vulnerable sections of the society, such as herders, nomads, uh, pastoralists, etc. Therefore, the assessment should capture the relevant information pertaining to each of these areas and vulnerable population group in each context. So for effective implementation, monitoring system should be worked upon. In this case, it is important to design, establish, or strengthen the existing monitoring system for regular flow of information on uptake of services of various food, nutrition, and agriculture related schemes. The data from TDPS, ICDS, Poshan Abhiyan, NIDM, Manregas, and Market Information System, which maps the project participants, captures the key indicators, is a valuable source, reduces burden of primary data collection, and can facilitate faster decisions. So the strategy on FNS, it provides the overarching framework for the response to a food and nutrition emergency. It provides the vision for an interagency action plan for a collective and therefore more comprehensive and evidence-based response. During the developing the strategy is a progression from defining the needs and response to creating space for individual agencies to make links between their own internal planning process and implementation of the collective response. The contingency plan should be established for FNS strategy, that is food and nutrition security needs, and the responsible stakeholders should be identified at the national level, state level, district level, block and village level for effective implementation through INGOs, NGOs, private corporates, UN agencies, bilateral, multilateral partners, civil society organizations, agencies, community groups, and food supply chain agencies. In addition to this, for livestock intervention to protect livelihoods, communities, and livestock, the standard need to be adopted. And moving forward to the recovery period, while a subset of micro and small food enterprises will receive direct aid, it is the informal sector that will continue to be the most important source of fresh food in India. So if implemented, the government's recovery measures offer brighter prospects for food safety in India, on one that promises to draw in the private sector. We are at a moment in the history of India's food system when improving food safety looks like an extremely attractive investment proposition. Nevertheless, the challenges are significant. India's food safety programs are huge, and the supply of skills and resources to address them is scarce. What the COVID-19 crisis has done is begun focus the attention of authorities on the big food safety and health issues. This includes opportunities to better communicate food safety risks and ways to reduce them, both to the general public and to the private food sector, a role that FSSAI is trying to undertake as part of its COVID-19 response. For the recovery package, the main challenge will be closing the policy implementation gap and making food safety and hygienic practices the new normal from farm to fork. The COVID-19 response has the potential to change India's food safety culture among all stakeholders, including policymakers, the agri-food sector, regulators, and consumers. But such changes will happen only if there is a well-informed demand for better and safer foods. So encouraging such demands will depend in part on future research on the cost of food safety, performance index, and risk communication. Having said that, uh, I am thankful to NIDM and Professor Anil Gupta that such an important topic has been brought today to the public for discussion, and with the eminent speakers coming in who are dealing with this subject day in and day out. So we are keen to hear the panelists for their important involvement and the experiences in this sector as to and how we can address this particular sector in future. So with this said, I will hand over to Fatima for taking the webinar forward. Thank you.
Thank you so much, sir. Thank you for sharing this experience and what we should do for the change in the food safety culture and demands and safer foods and cost of food safety, which is going to be rise in the coming decades. So, thank you so much, sir. Now, I would like to invite uh, uh, Professor Anil K. Gupta, who is head PRM NIDM, for his remarks. Just let's give me the brief introduction of Professor Anil K. Sir.
No need, Fatima. Actually, being the convener of the program, it is my duty to welcome all the.
My apologies.
No, it's all right.
Some issues were there.
I should welcome our executive director, Major General Manoj Kumar Bindal sir. He has very nicely set the stage for the discussion of the day. I welcome the country director, WFP, for agreeing to grace this occasion and to deliver the special address. In fact, NIDM and WFP is planning a series of webinar jointly on this important issue, and also to take up some joint policy publications that we are under discussion. I welcome Dr. Anil Kumar Singh Saab, who is the former Deputy Director General NRM of ICR and currently the Secretary of National Academy of Agriculture Sciences. Welcome, sir. You are always very supportive to the endeavors of NIDM, and your guidance in preparing the National Agriculture Disaster Management Plan has also been very useful. I welcome Mr. Peter Nelson to this forum. I welcome Pradnya, who has been very supportive since beginning, and to design this cooperation. And I welcome Shushen Milkar to this forum. And I'm sure that today's deliberation would be very useful. What we are going to discuss today, and what we are discussing globally, there is a little bit of special issues that pertains more to India, because in India we have when we talk of the food security issue, it is more of a nutritional issue. So that only the availability of food is not sufficient, and that is say that nutrition is more than filling the stomach. And the disruptions that natural disasters or environmental extremes that are causing to our supply chain systems, to our stockpiling, and to the quality and quantity, all the aspects, and the disruptions during any kind of disasters, as our executive director also referred to, that is posing kind of a lateral challenge which has not been at the forefront discussion in the disaster risk reduction for quite some time. But if we look at the data, that a large number of children in India are under malnutrition, and that is leading to even stunted growth. So almost 32% of the children by 2022, there is an estimate that will face different degree of impact in terms of the stunted growth. So these kind of things since are posing newer challenges, and with advances in technology, advances in early warning system, and advances in the effective food management, including the food processing and technology, we are here to discuss this, that how the post-harvest agriculture produce management in terms of food security, and rather nutritional security, adding to the health security. So there's a lot of integration issues which are here. So with this, I extend once again to all the participants and to all the panelists and to the keynote speaker of the session. So thank you, and over to you, Fatima. Yeah. Fatima.
Thank you, sir. Yes, sir. Thank you, sir. So now I would like to call for this special address. I would like to call Mr. Bishop Baroli, as he has to left early. So I'll just give a brief introduction of him. Mr. Bishop Paroli, WPF representative and the country director in India, took office as United Nations World Food Program representative and country director in India in September 2019. Mr. Paroli brings 35 years of distinguished experience in development, humanitarian affairs, diplomacy, fundraising, and management over 10 countries in India, Middle East, and Africa, and WPF headquarters in Rome. Prior to his current assignments, Mr. Paroli served for the past 5 years in Zimbabwe as the UN resident coordinator and the resident representative of the United Nations Development Programme. Prior to joining the UN in Zimbabwe, Mr. Paroli served as the UN Food Programme representative and the current country director in the Yemen, and in WPF HQ in Rome as the chief of the staff and the director of executive director office, as well as the director of government donor relations. From 2008 to 2011, Mr. Paroli worked as UN resident and humanitarian coordinator and UNDP resident representative in Myanmar. Bishop has also served in various positions in Mr. Bishop Paroli, so please.
Okay, thank you very much. Good morning. I want to appreciate first for organizing this event and inviting me. My warm greetings to Major General Bindal and also Professor Gupta and also Dr. Singh and all other esteemed participants. Indeed, as highlighted by Professor Major General Bindal, food and nutrition issue is a very, very crucial issue in any disasters. In fact, food is part of a life-saving issue. The first thing comes in any disaster is food, then of course health, water, sanitation, shelter, and all that. And considering the adequacy of the food and adequacy of the nutrition and adequacy in terms of different categories of vulnerable population affected by disaster are important responses for meeting the basic need of the people. And of course, preparing for it and preparedness and advanced positioning, right amount of right technology use and assessment so that no one is left behind is really fundamental. Indeed, in the context of COVID, we have learned a lot. Although COVID-19 pandemic was originally looked at more of a health disaster, it has proven to be a major economic disaster, major food insecurity disaster, livelihood disaster, and its aftermath is likely to be felt for a long time. And therefore, we can learn from it a lot in terms of our preparedness. Also, India's response itself has been really major and significant. We can also learn from that going forward. So therefore, convening this event around post-COVID food and nutrition security is a commendable step. So I want to really congratulate NIDM for holding this session. Starting from the beginning, lockdown and the various element of responses which India started, and the movement of migrants across states in millions number has given us a lot of lesson in terms of the need for quick responses as India did in food support, the coordination with the strong 11 different high power bureaucratic teams on food and logistics led by Secretary Iyer and cross ministerial engagement where we were very honored to be part of it as a UN system, WFP, and adding value in terms of providing daily information and supporting in various stages of policy work and intervention measures. The other aspect is what can be learned is the food stock which India had, for example, in huge number. Of course, it's been a years of contribution in terms of success in agricultural production, but then the stock of 75-80 million tons, and then starting from 1st of April, provision of rice or wheat as well as pulses to every individual across the country, covering 800 million people under TPDS, and then, of course, take-home rations for school children under midday meal, and also using these volunteers under ICDS program. I think these have been, really super example of mobilizing support and all. Considering the point Professor Gupta mentioned, the high level of food nutrition insecurity, particularly malnutrition and all that, had already put a challenge. And we can imagine if these interventions were not done, how we would reach to that. But then we have also learned through the process that there are people who did not, qualify to receive those support, and then the states and the central level made major interventions in breaking down that restriction in terms of conditionality of ration card, and temporarily making provision, and also provision of cash support, etc. Were really major intervention. Indeed, normally the first step on disaster is right type of assessment, looking at who needs it, what is needed, what are the gaps, and how do we cater to the need of the most vulnerable, mother, children, as well as those who would normally not benefit. In the case of COVID, there were cases, for example, like sex workers, HIV positive people, and other normally, and even ordinary people who who lost their jobs and who lost their income, and they become really dependent on food, vulnerable, who would normally have their own livelihood. And I think that element of flexibility, millions of volunteers involved, providing like 20 million people with these volunteer kitchens, cooking meals, catering through the quarantine center. I think it was a massive efforts and interventions. I think it has brought out a lot of lesson, and also the as was referred, the private sector, the community organizations, the civil societies, which got involved in reaching out to the needy people, has been really magnificent, and a lot has been learned. Indeed, the situation is being stabilized through various interventions, bringing jobs back. There were efforts made to continue the supply chain. In fact, as an organization, we even created a web application to link farmers to the consumer, and help farmers sell this produce as well as the consumer to buy it. There were challenges like farmers involved in flowers could not sell their produce. Farmers producing poultry and other, the fish, those who are involved in fishing industries, those farmers were not able to really market it. There were enormous unknown because of the nature of the pandemic, but a quick adaptability and flexible approach, and mobilization of logistics, supply chain. I was looking at some of the statistics of Indian Railway, doubling the deliveries during a month to cater to the need of the food requirement and supplies, and the states making major interventions, so that no one is left hungry and behind. Remember the TV advertisement made by the Chief Minister of Delhi himself, appealing that no one should go hungry, and to meet that. Of course, the point was raised and mentioned that the key is not only meeting the calorie part of it, the rice or the wheat, but basic overall need. And indeed, I think we can learn from that. How do we make sure in future those concerns are addressed? Also, concern of the point that although there were so much rations provision in the state safety net program, but the people who were moving or migrant didn't have the access. So the introduction of the one nation, one card system, which has been brought out, great learning and an example, and also during those COVID red zones, making a special provision to deliver food to the families, catering the need of the children. Unfortunately, the level and efficiency and efforts have been different at different states because of various challenges and constraints. So these are some of the things I guess one can learn, making it further improve on the system and delivery of required food. And globally, as was mentioned by Major General Bindal, WFP has been in the forefront talking about the plight of the hungry poor and rising hunger. The COVID has increased the hunger from 130 million people to 270 million. And the situation is really severe in some of the war torn countries where there are refugees, displaced people, and also where the situation is combined with natural disasters such as drought or cyclone. So there is an increased appeal WFP is making internationally to prevent famine, and my executive director has been really at the forefront on this. And it's also good to mention it here is, the World Food Program was awarded Nobel Peace Prize in 2020 as a very humbling and joyous moment for the World Food Program and its partner like yourself. But also it brings the plight of the people, 690 million who are not getting enough food daily, plus the 270 million who are verge of famine because of the rise in COVID. And therefore bringing the efforts together, learning from each other, putting a solidarity among nations, communities, I think is really important in this moment of a global pandemic and global crisis, particularly to the most vulnerable, and therefore the challenge of the SDG 2 and the whole aim or ambition of zero hunger is achieved. Indeed, we have enough food in the world to feed everyone, but the main problem is accessibility, and that's where we need to work on and join hands. And thus, efforts like this, learning from each other, and then putting system in place, capacitating institutions, and working together. I would say a few things probably we need to keep in mind going forward. One is we need to really watch out the vulnerability, continued vulnerability in the pockets, among the communities so that no one gets hungry, no one remain hunger, and there is enough food and nutrition need met among the vulnerable population and the most needy people. That's one part. Number two is good lesson to be learned in terms of good coordination among different players so that there is less overlap and reaching out everyone and complementing the efforts is number two. And number three is also continuous capacity building, institutions, engagement with civil societies who really play an important role in meeting smile in the context of delivering most needed food and nutrition support, and finally continue have that engagement with governments and improving government system so that this is covered under as a part of national commitment, national program, and national efforts, and then of course complemented by institutions like us and many others who join in these efforts. So thank you very much for this opportunity to say a few words and share our experience. And I want to really commend the great effort being done in India and the good partnership everyone has so that no one goes hungry. Thank you very much. Back to you. Thank you.
Thank you very much, sir. Thank you for sharing your ideas, and thank you for telling us the important role in the last minute, like the need to watch out the vulnerability among the communities. Yeah, so that we can overcome the hunger and the lessons we learned. We learned in the COVID-19 and reaching out continuously. Yeah, there were a number of volunteers who worked on during this COVID-19 and make sure that everyone who are in the need to get food, they make it delivered to everyone who was in the need of food. Yeah, thank you so much, sir. And we would appreciate if you stay for some minutes more because we are having a panel discussion. If you want to. So, coming to the panel discussion, I would like to invite Dr. Anil K. Singh, who is Secretary, National Academics of Agriculture Science, New Delhi. Anil K. Singh is currently the Secretary of National Academy of Agriculture Science and was Vice Chancellor of Rajmata Vijayavareja India Agriculture University, Gwalior from 2012 to 2017. And prior to the Deputy Director General NRM, ICAR 2007 to 2012. He had made significant contributions in the field of natural resource management with a specific focus on soil, water, plant, atmospheric interactions. He was instrumental in the formulation of district-wise contingency plans for tackling extreme weather events, which had installed drought proofing in the country's agricultural production system. When he was at ICAR HQs at DDG NRM, he also initiated the mega projects of ICAR, National Initiative on Climate Resilient Agriculture, during this period. Dr. Anil Kumar K. Singh, sir, please start the panel session.
Thank you. I hope I'm audible.
Yes, sir.
Okay. Thank you, Fatima, and good morning to Major General Bindul, Professor Gupta, and Mr. Parajali, and my panelists in this discussion. Thank you very much for inviting me for this very important topic, which is related to food and nutrition risk disasters, particularly focused from COVID-19. I think we are all very familiar with the natural disasters which have been occurring over time, and we have been sort of taking care of droughts, floods, and cyclones. You know, the frequency of all these events has increased, and we have a mechanism in place for these things, and we have been very proactive in taking action. But when it came to COVID-19, you know, it caught everybody by surprise. And in addition to that, we also had locust attacks, which is again also we also say that more pests and diseases are going to be coming up as a consequence of this climate change. So when this COVID took place, everybody, as was mentioned by uh, Mr. Parajuli and also by Major General Bindal, that uh, it had a lot of very significant impact on the economy. But I would just like to mention this, that uh, agriculture sector could provide a little bit of immunity to the economic status of the country, in the sense that out of the 8 sectors which contribute to GDP, only agriculture sector was the positive one, and it was around 3.4%, while the other factors reduced the GDP by almost more than 23%. So that way, the agriculture sector was a positive thing. And when this COVID took place, in fact, it coincided, the lockdown period coincided with the harvest of the winter season or Rabi crops. And I think Dr. Mr. Parajuli has mentioned the action taken by the government, and it is our food production system which in fact came to the rescue of all the people who were around, because we could provide uh, rice, wheat, even pulses and other items to the general public at very low price, subsidized price, or even free during this period. So this goes to at least signify that the our system worked. And just for, because there are some students, postgraduate students here, I would just like to mention that we have been feeding a population which is about 17.5% of the global population, with 4% of the water resources and 2.4% of the land resources at our disposal. And we also have about 15% of the livestock population. And I think India is one of those countries which has also enacted the National Food Security Act, which those who are below the poverty line have a legal right to food. So these all things that have really been somehow welcome sort of steps which helped at least nobody suffered because of lack of food during the COVID and subsequently later. But yes, there were effect on the agriculture sector. Of course, if you look at the statistics, we had a record production of food grains, a record production of horticulture, record production of pulses, a record production of coarse cereals, oil seeds. All those statistics are available there. But even then, there was impact on the poultry sector, their consumption, because of many reasons, and one of them was also a rumor that probably if you eat poultry meat or you take egg, you can get COVID-19, get infected by that. One of the reasons. The dairy sector, because a lot of it is unorganized, and because of these things, all these things got affected. Fishery sector also was affected because of these. International trade was also affected because of transport and so many other things. So we had all, in spite of all these things, we were able to at least feed the people who were around, and I think Mr. Parajuli explained that very well. Now, one thing which was very much highlighted and COVID-19 was the factor of immunity, and that is where the whole nutrition aspect is linked. And suddenly we all realized how important the vitamin C is, how important zinc, how important vitamin D, and as you all know, healthy milk became one of the regular items. Having turmeric to milk and then drinking it every day was again one of those factors which is supposed to add to the fighting the COVID-19 pandemic. And if you look at all these things, uh, but if you look, we have, I think, in fact, we all take pride that India is one of the youngest nations. But when we look at the malnutrition level, I think this is being highlighted. Mr. Paradili mentioned about the malnutrition. If you really look at the statistics, they are quite disturbing. We have the largest number of malnourished children in the world now, even more than what is sub-Saharan Africa. And if you look at the data, there is underweight children is almost 30 to 36%, anemic children is about 58%, prevalence of anemia in women and girls is about 53%. That means half the population. Now, this is very disturbing. So, the government has now started a project called Poshan. Poshan in English means nutrition, Poshan is for a Hindi word, Poshan Abhiyan. And they have fixed up certain targets which have to be completed by 2022. And so, if you look at this, how do we take care of this? And if you really look at the data, one of the things that is lagging is the data is the revised data came after a gap of 10 years, so there is probably need to have real time data on year-to-year basis. And I was reading somewhere that they said that this malnutrition, where you have 1 in 3 children stunted, malnourished, wasted, that it can affect GDP almost up to 3%. And people have the International Labour Organization has given a statistics that in case of India, the loss due to the illness and death due to malnutrition would cause anywhere from US dollars 10 to 28 billion. That means 3 to 9% of GDP, which means that it does make a lot of effect. Now, how do we take care of this? Because we have enough food, as was mentioned repeatedly. We can take care of the food part, but yes, nutrition security has become a big issue. Then, how do we take care of this, and what can we do? Post pandemic, the government has, of course, taken initiatives to boost up the agriculture sector. Almost, I think, 1.5 lakh crores were allocated to agriculture and allied activities, building up a post-harvest infrastructure for storage, for post-harvest and all these things, because these are very, very important. So that because it was the perishable products, the vegetables and horticulture crops which were affected, not the cereal crops. And it is the vegetables and cereal and the horticulture products which have these nutrition items which we talk of, whether it is vitamin C or we talk of zinc or vitamin A or whatever it is, in D also. We have the milk system which is now fortified with D. So we have taken some steps, but even then, how to take care of this? We talk of One Health program now, and we talk of plant, animal, and man and humans. What we forget is that the soil is the starting point. And if you look at the data of soil, micronutrients in particular, we are highly deficient in zinc, almost 37%. Soils are deficient, and zinc has become one of the normal recommended uses for crops. We have iron deficiency, almost 13%. Again, as I was mentioning, we have almost 50% of the women and girls who are anemic. The manganese deficiency, 7.1%. Copper deficiency is increasing, so 4%. Boron efficiency, again 23%. Molybdenum is just starting to take up, to increase. These are those things which the deficiency of which affects the health. The plants are deficient, and the plants that are consumed by the animals and humans are also deficient, and they are manifested through many of the diseases which we link to malnutrition. And I think India is so huge that probably no health system can really take care of all this population. So how do we take care of this nutrition? And I would like to just mention one of the ways is how, as was mentioned, that we have a public distribution system and we provide goods. So the Indian Council of Agriculture Research and other state agricultures have now come up, and I would just like to inform the House that on 16th October, which is the World Food Day, FAO had celebrated the 75 years of its existence. And on this day, the Honorable Prime Minister dedicated about 8 crops, 17 biofortified varieties. As I mentioned, if you can biofortify the food items that are being consumed by the population, you can take care of this nutrition aspect to quite some extent. And these varieties, I'll just list them out. I can't give you the details, too much time would be consumed. They have 1.5 to 3 times more nutrition than the conventional varieties. They have now rice varieties, which is having more zinc and more protein content also. Wheat varieties, both protein and iron. Maize hybrids have come up with lysine and tryptophan. These are enzymes which are required for our growth and development. Finger millets, which is generally considered the poor man's food, that they have also both calcium, iron, and zinc. Millet, mustard, groundnut, yam, so many, all these varieties. 17 of these varieties were dedicated to the nation, so that once these entered the food chain system of our country, it will probably take care quite some extent about the nutrition aspects or the lack of nutrition which is taking care. And as you all know, that in the SDGs, which we are also committed, zero hunger, good health, these are all SDG goals which we have to take care of by in another 10 years or so. I think this is all what I would like to just highlight, that the steps that we are taking, the sort of developments we are taking care, there were disruption in the supply chain and all these things. Hopefully, now a system would be in place so that in case something like this happens again, and I'm sure NIDM always comes forward with an action plan, and they would certainly be having a well-defined action plan. Uh, with these words, I thank you once again, Professor Gupta and Major General Bengal, for giving me this opportunity to share some of our thoughts on how we have looked at COVID-19 and the agriculture during this period. Thank you very much.
Thank you so much. Thank you for sharing such a informative information with us. Thank you. Now, I would like to invite Dr. Suzanne, who is Project Director, Food and Nutrition Security, Enhanced Resilience, awareness, India. Susan is a senior professional in development economics with more than 15 years of experience at the Giselle for International and the United Nations Development Program. She has focused her professional life and research on cross-sectional governance process for reducing poverty and inequality, and on strengthening systems and process for improving evidence-based policy making. In her previous post in GAZ, she worked as senior evaluation specialist and as a policy advisor on the 2030 Agenda for Sustainable Development. In UNDP, Suzanne has worked on regional projects in Eastern Europe and Central Asia, dealing with poverty and vulnerability analysis, human development, and statistical capacity building. Susan holds a doctoral degree in social and economic science for the Vinia University of Economics and Business Administration and a master's degree in economics for Manchester University, Netherlands. Dr. Susan, ma'am, please.
Thank you very much. Thank you, Mr. Gupta, for inviting me. Hello and everyone. Thank you for the opening remarks by Mr. Parajuli and Mr. Bindal. Thank you very much. I have actually prepared a few slides. I'm not sure if it's possible to share them. I have no right to share content.
Ma'am,
Fatima will allow you. Yeah, Fatima, please allow sharing.
Yes, yes.
Mhm.
Has it been done, Fatima?
Ma'am, you're present now. Yes, sir. Yes, sir. Ma'am, you're present now. You can share your screen.
Thank you.
Ma'am, are you able?
Please.
Yes, yes, I see. I
Okay.
have tried to. Has anything been seen? Whiteboard? No. Can you see it?
Yes, yes, yes.
Yes, ma'am.
We can see. We can see.
Is it
Thank
in
you.
take note? Because I don't see it. No. Okay, so thank you very much. Yeah, as mentioned, I am the project director of the GIZ Food and Nutrition Security Enhanced Resilience Project. As probably some don't know, I would just say GIZ is a federal enterprise which supports the German government in achieving its objectives in the field of international cooperation for sustainable development. And this particular project is part of a special initiative of the German government, which is called One World, No Hunger, which was set up by the Federal Ministry for Economic Cooperation and Development in 2014. Further projects of this special initiative in the context of India are also implemented by GIZ, are the Green Innovation Centers and the global project Soil Protection and Soil Rehabilitation. So this project, the Food and Nutrition Security Project, has its main objective is to improve the nutritional situation of people vulnerable to food insecurity, especially women of reproductive age and young children. The project has started in 2015 and will continue until 2025. We are basically now in the middle, and we have seen from a recent evaluation that we are on a good track. But as now the COVID pandemic has come in between, and I will talk a little bit about how we adapted our programmatic response to that. And also what we are seeing now is that, for example, the recent data from the NFHS 5 survey round has revealed that the malnutrition problem in India is actually increasing over the last years. And that is actually based on data from before the pandemic. So that's quite concerning, especially now that the COVID pandemic may further aggravate the situation. So we have been working in the last 5 years in 3 fields of actions. One was to support the reform of the public distribution system. Here we have been supporting the digitalization and automation, and also improving effectiveness of access to services. We have been also through, for example, data analytics. Also, we have been piloting a social audit in Madhya Pradesh. The second field of action where we're working in Madhya Pradesh specifically is the improvement of nutrition and hygiene practices. And here we focus mainly on improving nutrition, dietary diversity of women through the so-called nutrition participatory learning and action approach. Here we are working together with the DWCD in Madhya Pradesh, and we are training the Angawadi workers, the frontline workers in 2 districts, in Chairpur and Chhatapur, to basically empower the women on dietary diversity. But it's basically nutrition education. In addition, since last year, we have been piloting 20 community nutrition gardens to improve year-round availability and access to diverse and nutritious local foods, and to economically empower women who are organized in so-called self-help groups. And I will talk a little bit more about these community nutrition gardens later and how they proved to be resilient in the COVID pandemic. And in the third field of action, we are working on knowledge management and institutionalization of these activities. Specifically, over the last 5 years, we have been supporting the institutionalization of an e-learning platform for systematic capacity building of frontline workers on nutrition education and counseling. So from March this year onwards, we have basically adapted our activities to the COVID situation. And I would like to show a little bit how we have adapted this NPLA approach and the community nutrition gardens and how they have been proven resilient to the crisis, and also what additional activities we have been doing. So basically, we are working at state and at district level. So at state level, immediately in March, we discussed with DWCD what can be done to ensure that the women still receive the counseling and nutrition support they need during the COVID pandemic, during the lockdown situation. So we organized together with DWCD a series of 10 webinars with Angawadi workers, where we exchanged with them on challenges during these specific times. And increased also their spirit and motivation. That was a very well received success by these frontline workers. And we have also collected 20 unique case studies about their work and their in these specific times. Also during August and during September, we have been focusing our support, our kind of campaign support in the World Breastfeeding Week and the Hoshanma virtual campaign with specific focus on the hygiene messages on the COVID pandemic. And also we have been customizing a community radio app, which is currently being piloted in the 2 districts with Angawadi workers to support also COVID messages and COVID success stories. Specifically now, when we go lower down to the district level, here we have been doing a rapid response initiative in Sherpur and Chhatarpur, where we're working together with our implementing partner Welthungerhilfe. Here the main objective was to prevent the spread of COVID-19, to improve food and nutrition situation during the crisis, and to protect livelihood and assets. Key activity in this response initiative was to support hygiene infrastructure in Angawadi centers and other public places, like installation and maintenance of pipi tubs and matka filters, awareness raising on COVID-19 related food and hygiene, training on preparation and distribution of dry rations and Nutri-Mix. Especially, we are just working on a millet campaign together with Angawadi workers and self-help groups. We have been also training on soap and sanitizer making and mask stitching at village level, and have been doing a lot of advocacy with Gram Panchayats for returning migrants and getting also helping them to understand what schemes are available and what rights they have. And the situation of the returning migrants in Madhya Pradesh, of course, was something during lockdown was something, important to understand and to adapt our programmatic response. So during end of August, beginning of September, we did a survey on the food and nutrition security conditions of returning migrants to assess the impact of the COVID situation on food and nutrition and livelihood of these migrant families returning to Madhya Pradesh. Let me just give you a couple of findings from this brief survey we did in these 2 districts. We have conducted over 13,000 interviews of migrant families. And what we see in terms of who returned, it was, of course, not only men, whole families returned from the cities. We see that there are more than 10,000 women among those that we have interviewed, and 8,017 children. The reasons for this reverse migration, as is known, but it was also quantified here, is that more than 80% migrated due to the lockdown, 50% also stated the lack of employment, and 40% also stated the fear of COVID as a reason. We also see, in terms of who returned, that it was mainly the unskilled migrants that returned. In Chhatarpur, we see 11,242, and in Sherpur, 9,783. So the majority of the migrants returned were unskilled migrants. What do we find in terms of food and nutrition? So we asked about whether daily essentials are available or unavailable, and that was the situation end of August, so we had still lockdowns in place. So here we see that 22% of the respondents said daily essentials are unavailable, and the reason out of these 22% stated 80%, almost 80% stated that there was no supply due to the lockdown. How did it affect the consumption patterns after the return? So we asked whether the consumption pattern has changed, and we see that almost 40% stated that the consumption pattern has changed, and in what way. We see that 54% stated out of these 39% that stated that consumption pattern has changed. More than 50% stated that food diversity has reduced, and also more than 50% stated that there was a reduction in quantity of food. Here we also see that there are almost 20% of respondents that say that they had only 1 or 2 meals per day after coming back. And in terms of coping strategies, we also see that 34% take a loan from friends and families, and up to 21.4% take a loan from moneylenders and others. So that's also an important finding in terms of how these families cope with the situation. In terms of farming and nutrition, we also found that only 28% of families found to have cultivated land, but that there's actually a majority of families interested to set up nutrition gardens. And since we are working in this area, this has helped us to then better align our strategies to that regard. Let me come to another topic that we have been working on already before COVID. We have been promoting local food as a strategy for dietary diversity using our PLA approach. And this also shows that this is a resilient strategy. So how are we doing this? So we have been doing this promotion using our participatory learning action tools, such as cooking demonstrations to nutritionally enriched meals. We have been doing participatory discussions, food exhibitions. Everybody brings food from home to discuss food groups and their nutritional value. So the emphasis here is on usage of local foods. Let me give you one example. So for example, we are promoting the use of moringa leaves. The use of moringa leaves and vegetables have been promoted and were usually before not eaten in the communities, but are now commonly consumed. And this was also especially promoted during the National Nutrition Month in September. I mentioned already the Nutri-Mix for children. Here we are supporting the women to understand the preparation and storage of this Nutri-Mix, what's the nutritional value, how it can be used with other ingredients, and you see that the cost and replicability is the cost is low and there's scale for replicability. Further, we have been together with DWCD working on a recipe booklet where we are having 30 local recipes for the 3 important phases of life. For example, adolescent girls, children under 6 years of age, and pregnant lactating women. And these local recipes are enriched with nutritious foods and nutrition information. So the idea is that, you know, we're using again the local knowledge, the local recipes that are being done anyway, but we are enriching them with further ingredients so that the nutritious value is increased. And these recipe booklets have been distributed to Angawadi workers and supervisors in both districts. Another initiative that took shape during the COVID-19 lockdown was the Poshan Matka, the Unique Grain Bank initiative. Together with DWCD, we initiated this initiative to support food security and nutritional needs by putting the focus on locally available food. Here, individual community members donate some amount of food grains, which are then collected and distributed amongst those who are in need of it most. Again, here's the emphasis on the importance of local and indigenous food grains, and this has been effective in mobilizing communities and shifting from a centralized to a more decentralized approach with wider participation in the community. And lastly, I wanted to give you a brief outline of the community nutrition garden. So we are focusing on the one hand, as mentioned, on nutrition education, where we have been supporting local foods. And on the other hand, we try to also improve the year-round availability of seasonal nutritious fruits. And this we do using the community nutrition garden approach. So here we are working with women self-help groups in these 2 districts to set up a community nutrition garden on community land. We are using here a convergence approach. We are working with different line departments, and the women also have, they are receiving wages from the MG and Rega scheme for their work. So key components of this approach is to mobilize the community, identify the land, empower the self-help group, and work with the different line departments once we are receiving seeds and saplings from the agriculture department. We are working with MG and Rega. We are working with DWCD. So this is a convergence approach to improve the dietary diversity. So again, the focus here is on the nutritious local foods grown by these women. And what we have seen during the COVID pandemic is that because we have set up these gardens last year and before the pandemic, they have proven resilient during the pandemic. Women continued to work in these gardens. They have done, in addition, our NGO partners have conducted COVID-19 awareness campaigns in these gardens for these women. Surplus vegetables were given to local quarantine centers and neighbors. Of course, there were challenges as everywhere. We had travel constraints, of course, due to the lockdown, but mainly the women were happy or glad that they could continue to work in these gardens and have the harvest from these gardens. So let me finish with one success story and one quote from one of the women, from Kamili Devi from Bhagwan village in Cherpur district. She mentions here that she was glad that during this lockdown period, I could add nutrition value to my family's meal with the help of the community nutrition garden. I have worked hard in taking care of the plants, and now I do not have to worry about the fresh vegetables as it is right here. Thank you very much for your attention. And yeah, over to Fatima.
Thank you very much, ma'am. Thank you for sharing us with the agenda and the current ongoing activities during COVID-19, your work you have done, and awareness raising on COVID-19 related to food and hygiene, and how the impact of COVID-19 on migrant families, because it was during COVID that a lot of migration took place, and the availability of daily essentials. Everyone talked about that. Yeah, thank you so much, ma'am. Now I would like to invite Ms. Pradnya Patnakar, who is SDG manager and is working at United Nations World Food Program. She's having experience in working in one of the world's largest humanitarian organization in the world, WFP, and earlier with CARE. Pradnya has experience of handling large-scale projects in the space of nutrition and health and HIV/AIDS. A student of public health nutrition, Pradnya's expertise lies in the development of strategic roadmaps, projects management, monitoring, and evaluation, research and vulnerability assessments, and mapping of experience of working with government and initiating work with grassroots level communities to scale to policy advocacy and contribution to the policy formulation. Her experience covers a large landscape. Pradnya is currently providing leadership to WPF India's effort to bring food and nutritional security to the forefront of the development agenda by undertaking periodic food security analysis at various levels. As head of programs, SDG manager, she is contributing to leverage WFP's expertise globally in the field of DRM to strategically support government system to design, monitor, and implement approach towards achievement of 2030 agenda. She is working towards expanding the scope of work to include climate change resilience and adaptive capacity among vulnerable population for sustainable food and nutritional security. Pradnya has headed the vulnerability assessment and mapping unit in WPF India country office for more than 10 years and has hugely contributed to institutionalizing the vulnerability assessment and food security analysis in India by bringing out food security at classes at various levels. Ms. Pradnya, ma'am, are you there?
Hello, thank you so much. Can you hear me?
Yes, ma'am.
Right. Thank you so much for that introduction. Fatima, I'll also have some slides to share. So it would be nice if you can give me access.
Yes, ma'am. I'm making you a presenter.
Thank you. So thank you so much for giving this opportunity to share our thoughts and experiences. And it had been a pleasure working with Professor Anil Gupta and Fatima Yu. And of course, I mean, we are actually partnering with NIDM to mainstream the food and nutrition in overall emergency response and preparedness package. And I really look forward to a very productive journey going forward. So from that perspective, I just actually for today, I had a few thoughts which that some of my slides. Please pardon me, I can't show both slides and the video simultaneously. I'll just switch off my hello.
Yes, ma'am.
Can you see? Yeah, can you see my
Yes, ma'am. Your
screen?
screen is available.
Yes, yes.
Yes, ma'am.
Right. Perfect. So, so what I'll do is, in about 10 to 12 minutes, I'll just share some of the high-level impacts of COVID on food and nutrition security, the lessons and insights, and then I'll just quickly let you know a few things that WFP has been doing in India, and I'm happy to answer if there are any questions. And if I have to leave early, maybe I'll ask participants to write their questions, and then we can answer those. So with these words, to my esteemed panelists and the guests of honors, I'll just like to bring your attention to the fact that the food and nutrition security is something which actually has a very direct link when we talk about the impacts of COVID. And it actually has been eluded by many of this, I mean, including Dr. Bindal, Dr. Gupta, and Bisho, and also Professor Anil Gupta mentioned about it. So how it really is linked? I mean, it looks a bit of shabby slide because there are so many arrows, but the thing is that it is like so much interlinked that you can see the main aspect. So if we talk about COVID-19, just a minute, let me make it 19. This is, yeah. So if we talk about COVID-19, it directly resulted in lockdown policies. And the lockdown policies and otherwise, I mean, impacts of COVID, they actually resulted in many aspects, including deepening inequalities, economic recession, which was again talked about, disruption in food supply chains, disrupted social protection, which also resulted in effect on food prices. In some countries, it was really very harsh. In some countries, it was not. Again, it had a kind of varied impact on food prices. Some commodities, cereals and all, they maintained the prices, but some commodities which are in fact more nutritionally required, they were affected badly. Then the changes in food production and altered food and overall food environment. And this all resulted in increased food insecurity and poverty. And if we see that, I mean, in a way, the change in food production actually has impact on food prices. It also results in deepening the inequalities. If we talk about economic recession, it again is directly related to deepening inequalities, and disruption in food supply chain has a direct linkage with changes in food production. If we talk about lockdown policies, actually resulted in stopping the transportation, for example, for some days. Definitely had impacted in the supply chains, which in effect on food prices at the global level or in some countries, as I said. The problems in the laborers, I mean, the migrants. So all these things were so interrelated that COVID, through all these factors, has direct and indirect impact on food security and overall poverty. And that has become more and more prominent with this epidemic. And that's where it's extremely important to pay attention to this. So if we talk about specific impacts, I'll just like to use some of the things which are highlighted by the high level panel of experts which are appointed by CFS, the the group which actually is also providing input to the World Food Summit. So the first is the supply chain disruptions. So there have been major disruptions in supply chains in the wake of lockdown, and which has affected in the availability, pricing, and quality of food. Then the second important aspect is global economic recession, which actually was being talked about before COVID as well. However, extremely prominent, and associated income loss became much more, which became multifold, 19 pandemic. So, I mean, in a way, the recession which was already there, it was exacerbated by COVID-19 pandemic, and the loss of livelihoods and income became to the huge scale. Then the third aspect, which is extremely important, is widening the social inequalities. And in fact, for India, we know that if we talk about the inequalities, there is a huge inequality. Some of the statistics have shown that almost 30% of income is held by 1% of population, and so on and so forth. So it's like COVID has actually widened the social inequalities, and this is triggered by economic slowdown as well as the health emergencies, spread of the disease itself, it has actually given rise to the inequalities. Some people, their access to food and nutrition services has become even more difficult. Then disruption of social protection programs. So WFP has estimated that around 370 million children have lost access to school meals due to school closure in wake of this pandemic. And this is a huge number. So the children who otherwise go to school, it's not just the loss of education, but also loss of meals for these children. And that actually has a huge impact. And it is just one example of the school meals, but other social protection programs have also been affected worldwide, and the impact has been extremely huge. As I said, it has altered food environment. It has changed the way the people engage and interact with food system and acquire it to consume the food. I mean, how to acquire the food, how to consume the food. It has completely changed that environment. There has been, in one particular period, there was quite a lot of attention on consuming processed food because it is easy to have the food which has larger shelf life than anything else. And so it is extremely important to understand these altered food environment, because it definitely has a very direct impact on food and nutrition security. Localized food price increases. There have been localized price changes affected by dynamics. And we look at overall, we used to say that the global markets now are integrated. However, the countries seeing localized food price increase because of the closing and sealing of the boundaries. There had been, some countries definitely experienced extremely high food prices. And there are potential changes in the production. As we see that, we say that we had record production of cereals. However, labor-intensive crops, often cultivated without migrant workforce in some countries, and particularly horticulture products such as fresh fruits, vegetables, are likely to be more affected by disruptions. And that's where we say that these precisely are the crops which actually contribute to the nutrition, and we can say that the deficiencies, which are micronutrient deficiencies. So these are important aspects which actually need to be taken into consideration. Again, gender inequality has been exacerbated by a crisis as women face additional burden during COVID-19, not just as frontline health worker and food system workers, but unpaid care work, community work, which has increased during the lockdown. And we actually hear lots of stories about uh, those. Even the work from home in the urban areas has led to increased work pressure for women, and loss of employment. If we talk about, again, women have suffered much more. And that's where I talked about deepening the inequalities. So now if we talk about implication of various dimensions of food security, usually dimensions, and these three dimensions include the availability, access, However, I mean, now when we talk about various dimensions of food insecurity, especially this high-level expert panel has taken into consideration 6 aspects or 6 dimensions of food insecurity and nutrition. And so in addition to availability, access, utilization, stability, and sustainability, they have also added agency as one of the important aspect of food insecurity. So how the availability is compromised due to COVID. So supply chain disruption, labor shortages, closure of processing plants, and closure of restaurants and food stalls, shift of shift to lower risk crops. These are all impacting the availability, not of just the cereals, but of certain type of crops, and those crops I just mentioned in the previous slide. If we talk about the access, there has been loss of jobs, and we know that I mean the estimates which are put up by ILO are really huge. Loss of incomes, I mean the food prices are getting higher, disruption of school meals program, curtailing social safety nets, diminishing access to social protection. I mean many people actually just could not reach to even get the benefits of their entitlements in the initial days or some period. Some people who were not part of social protection, they did not get the entitlements because they were in the normal circumstances, not part of it. I mean, government of India has been one of the very responsive governments who actually really took some decisions and ensured that through their multiple orders to get access of the most vulnerable communities. But closure of informal markets and comorbidities have impact on food access. Utilization, actually, if we talk about, then shift to cheaper and less healthy diets, as we said, uh, the shift towards larger or the processed food and shelf life stable food, and link between COVID-19 and malnutrition. If we talk about stability, supply chain disruptions, uncertainty on markets and input access, price volatility, and export restriction, this has impact on, again, the overall food security. COVID has also actually weakened power of farmers and producing organization, which actually also has highlighted the access to ICT. Many countries where there is no access to remote advice and all, there was, I mean, a lack of the information, inability to meet and organize, loss of affiliation and unions, loss of economic and social empowerment, which actually has resulted in a bit of weaker agency, which also adds to the food insecurity. And the last one is the sustainability, which is increased food losses and wastages because of the issues in transportation and a variety of reasons which actually were started by COVID-19, and decreased attention to climate change and environmental issues. We saw, I mean, while in the beginning, I mean, the environment probably became a bit more cleaner. However, the restrictions on the plastic, if you see, you can see everywhere it has just gone haywire and everybody is using the plastics. Then socioeconomic losses affecting food systems viability. So these are the aspects which actually contribute to loss of sustainability, and COVID has triggered it. But all these factors which are listed here are not just, I mean, COVID is just one case in point, but any other disaster, large scale disaster, or even local disaster can actually compromise these factors and have impact on overall food insecurity. So just a few insights. The interconnected nature of food systems, health systems, and economic systems, and the environmental system is one important aspect which has to be taken into consideration. So if we talk about the food systems or strengthening the food system or changing the nature of food systems, it cannot be done in isolation. We have to take in the cognizance of health systems, economic systems, and environmental systems. The second important insight that we have learned is widespread disruptions to food supply chains, which actually need to be more resilient. Diverse food distribution system and shorter supply chain and territorial markets. So it's like now a bit going backwards. So from globalization and long supply chain to more focus on shorter supply chain and territorial markets. And international supply chains are strained by COVID-19, relocalizing food production or seeking a better balance between imported and local produced food is a sound strategy of building robustness and resilience. And one important aspect which was highlighted by my predecessor, so home gardens and urban agriculture is also an important lesson that basically has a potential to build or strengthen the resilience to shocks and disruptions and ensure access to more varied nutritious food for urban poor as well. And of course, sustainable fisheries and aquaculture. So when we talk about more insights, food systems, if we want to make them resilient to crisis, they must be more equitable and inclusive, empowering and respectful, regenerative, healthy and nutritious, as well as productive and prosperous to all. And this actually is a kind of comprehensive statement which talks about or covers all the aspects that we discussed. So the second important insight is ensure food system workers' rights are recognized and integrated in national legislation. This is also an important aspect. And when we talk about the picture on the right side, strengthening farmer organization and women SHGs, promoting community-based adaptation and food reserves, developing climate resilient and disaster resilient communities is something which is which holds the key. And the most important thing is to promote and enforce compliance with established norms, pay special attention to migrant workers and protection of small and marginal farmers. So what it means to us in India, it is again, it highlights the integration of food and nutrition in overall disaster, climate change, and the preparedness and adaptation related practices. Existing food insecurity and malnutrition levels, I don't want to again highlight the statistics. It has been stated by multiple times by multiple speakers, but there is a exacerbation, there is a heightened uh, prevalence, and hence there is a potential that the world misses SDG 2 target, specifically related to food insecurity, undernourishment, and malnutrition. So in wake of that, it is extremely important to really bring the focus back to food and nutrition. And of course, the resilience building is an extremely important aspect. And so making food systems which are more equitable, nutritious, efficient, and inclusive, focusing on accountability to affected population who are most vulnerable, integration of food into not just the relief packages, but also right from the assessment to relief to response to preparedness, and improving responsive coordination of stakeholders. Just one stakeholder in vacuum will not really help. It has to be a kind of collaborative approach, and that has been highlighted, which also is the essence of SDGs. When SDGs, they are global targets and they are not just the government targets, or they are not just the UN targets. So they are basically for all stakeholders to work together towards achieving, and that has been underlined here. So then bringing nutrition to the center, and nutrition doesn't just mean the food, it's just the focus on overall first 1,000 days, the feeding practices, nutritious diet, and then the entire spectrum right from the production to, farm to fork, as has been said. And then ensuring the behaviors and the health practices, the food safety, the hygiene, and the other related aspects. Then strengthening the role of social safety nets. Social safety nets and social protection play an extremely important role, and they must be shock resilient and responsive. And some of it was exhibited, but how we have to work towards how they can really make a kind of smooth transition in wake of any emergency that may make. And is at all level, bringing in the technological advances and other expertise whichever is available. So now I'll just quickly walk you through in what WFP has been doing. So WFP was agency for UN to provide support to empowered group 5 and actually has worked with the civil society flag the issues where the food insecurity lies and divert the support to those areas through PDS and other aspects of it. And that way it actually really contributed strongly to ensure that the food reaches to the most vulnerable people. supported developing the SOPs and guidelines and social and behavior change communication on addressing nutrition issues. There were lots of the media support and the guidelines as well as the video spots and the modules were developed, which were actually made available, and they were not just in Hindi but Odia and Malayalam version as well, and even the guidelines for kitchen staff, ensuring the COVID standard operating procedures during cooking at the distribution center, how this actually can be done. So all these things were developed and popularized through various networks of government and non-government players. At state level, with Uttarakhand, Uttar Pradesh, and Odisha, we worked very closely with the Department of Food and Public Distribution. At the national level, the same relationship is carried forward in these areas, and various apps were developed to support the farmers and the linkage through Jana Apurti app. Radio jingles were developed in Uttar Pradesh. The national portability actually was implemented, and then overall support was provided to implement the One Nation, One Ration Card policy. We also undertook some rapid assessments on food and nutrition security in Odisha with the interagency groups, and came out with the actions, recommended actions. I think COVID actually has highlighted the response and need for societies and their importance as well, not just in the overall disaster response and relief, but also specifically food and nutrition security. And so we actually worked with various NGO networks under capacity needs assessment, organized some sessions, then worked on developing some of the food preferences baskets. IAGs, we supported 11 states meeting, supported 5 state interagency groups to have better government and NGO coordination. And we have actually undertaken a partnership with NIDM for mainstreaming food and nutrition in emergency, as I said earlier. And this we expect that will help integration of food and nutrition security in overall strategies going forward, which actually has started with COVID, but it has a long way to go. So just to conclude, the need to work for food and nutrition security has been highlighted like never before, and the importance of working together will never be undermined. And I think we are committed to work on that. So thank you so much for giving the opportunity. Over from my side, and back to you, Fatima.
Thank you so much, ma'am. Thank you for sharing your ideas of impact of COVID-19 on food and nutrition security, lessons and insights, and and the effects of food processes, prices, change in food production, altered food environment, and yeah, connection is important with health, economic, and environment and food. Uh, and increase food insecurity and poverty. Thank you, ma'am. Thank you for sharing with us. Now, I would like to invite Mr. John Peter Nelson, who is Executive Director of Indo Global Social Service Society, a national level development organization working across India. He holds a master's in social work, Madras University. He has working experience of over 32 years in national level development and program management. His expertise lies in the organization development, strategic design thinking, and disaster preparedness and response. He was leading the effective implementation of around 41 programs across India in the areas of disaster preparedness and natural resource management, livelihood, and entitlement programs. Mr. John Peter Nelson, sir.
Thank you, Fatima. Thank you for that introduction. First of all, thank you for inviting me and organizing this very, very important discussion. So once again, my appreciation to the Institute and Major General Manoj Kumar and Professor Anil Gupta for conceptualizing and bringing us together, and also to all my fellow panelists for the wonderful insights so far. We are a national level organization. I've been working on the issue of food and nutrition for the last 12 years, especially at the grassroots level, enhancing the resilience capacities of the food vulnerable people, how they can cope up with their situations. We have also a long history of working on disasters. Yeah. Disasters and food insecurity go hand in hand, because disasters affect the most vulnerable people, and food security is also affecting the most vulnerable people. And COVID situation has further complicated the food security situation of these most vulnerable people. And especially if you look at the rural areas, COVID-19 has impacted severely the small farmers and wage earners in their income, which come from crop production, wage earning, and livestock. Also, if you look at migrated laborers and landless laborers faced problem of cash crisis and food supply shortage. Small enterprise holders engaged in fishery, poultry, which was already talked about, goat rearing, and the people in the hills, honey making, spice making, have faced loss of livelihood as they were not able to sell their products. So my previous speaker also has said increase in the localized food price during the lockdown. Social protection program have been disrupted by COVID-19, which for a short time, which in turn are affecting the food security and nutrition, for example, midday meal scheme. So these are some of the challenges also in our working areas. The ICDS centers were not able to provide hot cooked meals. Take-home ration has been provided. Lockdown has impacted the income of the poor people, which has directly impacted on the food availability in the family. The fear was large number of population might have fallen to severe and acute malnutrition, protein and vitamin deficiency, which was because of this situation. Also, I think the Mr. Anil Singh has also said that this is also the harvesting of rabi season, which was also has affected, and villages did not have much access to cold storage. As a result, they had only two options left: either let the standing crops perish, which happened in few places, or sell it in the local market for the very cheapest rates to the unauthorized vendors. In some areas, even that was also not possible. Well, also in the urban areas, most of the time we also talk about nutrition security, mostly centered around rural areas, but also in the urban areas, loss of jobs and low level of food security is common in almost all types of informal sector workers. Several cases of undertaking alternate livelihood by informal workers during lockdown, example, vegetable, fruit selling, selling of other daily food items, they were also struggling. While COVID has taught us all these issues, I just would like to share with you some of these initiatives, what we have done, and how this, most of them are community level initiatives, which helped us to overcome. What we were able to do was a quick assessment of food scarcity families and PDS excluded families to link them with the PDS scheme. But that is one of the greatest service the government of India and the state governments doing is the PDS schemes, and how do we link them immediately. Initiated in forming lots of WhatsApp groups involving local government officials, PRIs, and village development committee members for sharing village level information to the government officials for quick action. What we appreciate as a community initiative is the families in many of these villages supporting their neighboring families in terms of diversified nutritional vegetables from their kitchen gardens. Some of my previous speakers spoke about promoting kitchen gardens. One of our big program is nursery and seed banks, which we have done in quite a lot of villages. This helped us to restart the agricultural practices. Community-led nutritional food preparation, community-led kitchen, and demonstration of nutritional food preparation to enhance the cooking capacities and consumption of nutritional food among the pregnant and lactating women. This also has helped. Nearly about, in the last 7 months, about 8,000 women have been identified and proactively participated in the orientation demonstration session to understand the benefits of balanced diet. Using locally available drumstick plants, for example, leaf, banana, watermelon, using these locally available food items, people have helped people to how they can make good food items and snacks which can be helped among the target families. One of the important aspects of our programming in this nutritional aspect is the homestay vegetable garden. Orientation demonstrations have been organized in the household level. Climate resilient varieties of vegetables and fruits were promoted among the target families. Annual food calendar was prepared for each family, and households have started practicing vegetable gardens in their homestay and increased the availability of food varieties for self-consumption. Introducing crop diversification for enhancing livelihood option during COVID-19. So what we were looking at COVID-19 is not only for the first few months of providing food, but also how do we look at on a long term. So assistance has been provided to farmers in evolving crop diversification measures into their concurrent farming measures. Measures of mixed cropping were introduced in the Kharif cropping involving pulses and maize in between primary crops, which helped farmers to increase diverse product range and reduce the risk of changing climate. We also promote farmer field school in all these villages where we work, which help women farmers cultivate whatever they have learned from the farmer field school, and good number of women have harvested nutritional vegetables which they could sell as well as consume in their own. Looking at all this, from COVID lessons learned, also from previous disaster response, food security involves around various issues. What we talked about is, but mostly it's also livelihood, agriculture, local food availability, and community preparedness, along with all the other elements my previous panelists have said. One way of ensuring micronutrient intake is to assist the rural population in growing their own food in small kitchen gardens and supply them with micronutrient-rich food items. I think this is important. As I said, locally grown food also helps in income growth and self-sustainability of rural population. If coupled with building resilience of the community towards climate change, will help mitigate the loss of agricultural produce to climatic disasters. IGS's Indo-Global Social Service Society has been involved in initiatives that encourage local produce with a vision of mitigating malnutrition among children and women. Building resilience of economically and socially marginalized communities in India to diversify their nutrition intake through sustainable agricultural practices. I think, as I said, along with livelihood, agriculture is also very, very important. And looking at how do we look at sustainable agricultural practices because we also talked about soil nutrient and sustainable production. I think that's where the sustainable agricultural practices and adoption of climate resilient agriculture are also helping in providing diversified food and micronutrient rich food to the families. This is another aspect which I would emphasize. As one of my recommendations as we move forward is maintain a robust social safety nets and strengthen social protection system for nutrition, which we have. How do we maintain that and how do we continue to strengthen them? Disasters often aggravate the pre-existing issues and vulnerabilities. The poor, the lactating mothers, the infants, and other marginalized communities who are actually prone to disasters. And then added to these disasters, this food, once they get affected, this food insecurity also affects them. As part of this is, as a response, one of the things which we try to promote is ensuring variety in food baskets, such as pulses, vegetables, and micronutrient fortified foods to ensure food security. So it's not very often we tend to look at rice and wheat or all, but also look at other a combination of food in a food basket. And disaster preparedness to address nutrition. For example, if I gave we in Indo Global Social Services, we work in remote villages in Karlamanda block in Kalahandi district of Orissa, which is prone to droughts. There we are supporting vulnerable farmers to adopt climate resilient agricultural practices, which ensures food security in times of crisis. This block is prone to both drought and situation like flash floods. So a good adaptive agricultural practice also enables communities to cope with the food insecurities. The impact of COVID-19 or any disasters on livelihood are context specific and affect people differently. Saving the livelihood and ensuring food security of vulnerable groups should be the priority of government and all other organizations through scale up of various forms of support. We learn from the gaps from the lockdown, which many of you have previously said, which helps in evidence-based decision making to address these gaps. What are these lessons, what we learned? One of the things what we learned in our institution is that identify communities with pre-existing vulnerabilities impacted by lockdown or other disasters. So monitor closely with them as any new shocks or if there are any further lockdown, how that will have an impact. So we have a data-based and evidence-based programming would help. Also, one would be to look at how local governments could waive off requirement to provide any documentation such as BPL card or ration card, at least for the first few weeks of any such disaster so that people can have access to it. Lastly, I would also suggest that when we talk about disasters and nutrition, we should also remember urban poor and especially the homeless population and migrant workers who live on the streets. Special focus to urban homeless and migrant workers in the food and nutrition security is to be addressed to ensure they are protected from the health risk. These are some of my thoughts and some recommendation based on the experiences of the COVID. COVID-19 also has taught us very, very important insight is that the community, local communities are strength. When we are not able to have access to the communities, the local community infrastructure is our strength, and then we should continue to build local community infrastructure as part of our disaster preparedness in addressing food security. Thank you very much. And once again, thank you for giving me this opportunity. Back to you.
Thank you so much, sir. Thank you for sharing your ideas and for telling us that how COVID-19 make it more complicated to most of the vulnerable group like poor people and how it affected their food security. Community nutritional food preparations for pregnant and lactating mothers, how that program will how that program will help the pregnant ladies and lactating mothers. And now it's the time for valedictory session. For that, I would like to call Professor Anil Kumar Gupta, sir, who is head ECDR division. Sir, please give your valuable remarks for the session.
Thank you, Fatima. And I was listening to all the panelists, and in fact, it was so rich. And what we realized that the issue was issue of food and nutritional security and disaster risk reduction. So looking into the kind of a multi-pronged relationship between these two disciplines uh, uh, is so vast, and there are numerous dimensions to this, starting from the sustainable agriculture to food processing to the related infrastructure issues, and equal number of social dimensions. And there were a number of recommendations which have emerged from this from the deliberations and the presentations, which also brought in a lot of practical insights and examples, and the programs which are ongoing, and the special interventions during this COVID lockdown, COVID pandemic period also. So I would like to summarize in few points that the very first thing that I would like to see the relationship between food nutritional security and disaster risk reduction with in two ways. One is that the serious level of food and nutritional insecurity itself can take the form of disaster. This is something which has not been recognized as a disaster, but as we all believe that it is not the disaster that is natural, it is only hazard, but the vulnerabilities make any hazard to be realized as disaster. So food insecurity, when it takes the form of a grave situation and a very serious level of disruption, so without any disaster it can take the form of disaster. And second thing, food and nutritional security during the disaster events and in the subsequent period when the disaster is over, but the systems are already disrupted, and recovery recovery requires lot of a kind of a period. So we talk of the short-term recovery, medium-term recovery, and long-term recovery. So these two dimensions. Then the sections of society which are differently vulnerable to this issue. So we need to look at women, children, but we also need to look at the aged people. So because the care of elderly in terms of their food and nutritional requirement, so that is also a point that we can keep in mind. And food and nutritional security is also a major dimension and need to be integrated in the overall human resource development or human capacity management framework, because the food insecurity or nutritional insecurity also contribute to absenteeism from work within organized and also in unorganized sector. So the loss of human work productivity, besides the loss of longevity. So these are other dimensions. As some of the panelists also referred to, that the food insecurity is contributing to increased health risk burden. So that is that we need to look into the increased health expenses at individual level, at family level, at society level, and also at the level of government. So by addressing food and nutritional security, we can even reduce the health risk burden and health expenditure burdens also. Then food and nutritional security also has a direct linkages with the mental health issues. So challenges also, and if we are taking care, then the mental health benefits, because a lot of social disruptions and from smaller to larger conflicts globally had some kind of direct or indirect relationship with food, availability of food, quality of food, and also I would say that the kind of consumption patterns. So these are other dimensions. Then coming to the issues of supply chain disruptions during disasters and emergencies. So the issues for looking at local solutions and self-reliance, like the GIZ supported interventions and other project interventions which were discussed here. That how we promote local communities and the individuals in society to identify and promote the local solutions. Then proactive stockpiling or proactive planning, and looking at the alternatives in the food supply system during emergencies. So these are other things which emerged, and we also had the lateral experiences during this corona virus pandemic period also. Then a very significant level of increase in the food and nutritional security risk is posed by the impact of climate change. That in fact the climate change contributes to the loss in terms of quantity, so availability of the food materials, then also the quality. So even the food is available, what is the quality in terms of food safety and in terms of its nutritional value and contents, as Dr. Anil Kumar Singh Saab was also referring to the deficiency, and this deficiency cycle we have to see that, looking at the natural resource system like soil, then agriculture, then converting into food, then reaching to home, and then reaching to the stomach, and a lot of wastage or degradation in the food and nutritional value. So that is another dimension which Pradnya also referred to. Then another dimension, going little micro, when we are talking about women in general. So pregnant women and lactating women, so their requirement of food and nutrition, and particularly during emergencies, and then added dimension of inequality, and beside this the food and nutritional requirement of infants. So these issues are also touched upon, and I will certainly look at these issues when we will be discussing with the WFP regarding some joint policy paper, and also maybe some case studies of integrating that, how we can integrate into the planning process disaster risk reduction and climate change adaptation together, looking at food and nutritional insecurities. And therefore what we find that the local level planning at the district level, at even sub-district level, so going to Panchayati Raj institutions, and their sectoral or the departmental plans. So how we are able to identify the key departments which are contributing to the sustainability of the food and nutritional security. For example, the agriculture and all the sectors on which the agriculture productivity is depending, but equally on the post-harvest produce management, nutritional value chain, and also the improvements, then food processing, and then PDS, the public distribution system. So these are also the other dimensions which we will need to look into, and to see that what are the specific requirements during disasters and emergency, and how we can integrate so that we have more and more risk mitigation approach rather than only looking for whatever is available during our post disasters. So these are important dimensions which have emerged, and I'm happy that our executive director Major General Bindal Saab is also here full time. So I think he may also be invited to share his closing remarks. So Fatima, over to Fatima.
Thank you so much, sir. Thank you. Now, I would like to invite our Executive Director, Major General Manoj Kumar Bindal, sir. Sir, please give your valuable remarks on this session.
Thank you, Fatima. First of all, I must congratulate all the speakers, which were very, very rich in content and full of experience. And they gave out experiences from across the world and experiences from within India itself, and brought out such practical issues which can be implemented on ground without much difficulty. So I'm thankful to all the bringing all these things on the table, and also all the participants who have been patiently listening to everyone and absorbing the amount of knowledge that has come into this webinar through the speakers. And I'm thankful to Professor Anil Gupta and NIDM team for organizing a webinar on such an important issue, which generally is not considered as important during a disaster management risk reduction process, because finally it all amounts to response phase when food to the affected victims till the response phase is over. But here we have come to understand now today that it is a very long drawn process which starts from much before disaster strikes and continues till much after the disaster has already happened. And it's a cycle. It's a cycle which takes years to progress. It's a cycle which takes years to fructify, and hence a dedicated investment, dedicated programs, interventions for food and nutrition security sector is a must for any country to progress and to ensure that the vulnerable population, the lower income population, or persons with below poverty lines are well looked after, and they get the nutritional value when it is required. So I once again thank everyone, and it's been a pleasure for being as a participant also. Thank you so much. Over to you, Fatima.
Thank you so much, sir. Thank you. Now, on behalf of NIDM, I'm giving the vote of thanks. So, thank you, sir, for giving me the privilege to present a vote of thanks for this timely, important training program. I would like to extend my sincere thanks to the Executive Director, NIDM, Major General Manoj Kumar Bindal, sir, for providing his moral support and guidance to conduct this program. On the behalf of NIDM, our heartfelt gratitude to our special guest, Mr. Bishaw Parojli, sir, who is the Country Director, WPF, for addressing today's program. I must mention our deep sense of appreciation and thanks to the distinguished speakers for the webinar, Dr. A.K. Singh, sir, Secretary, NAS, Dr. Suzanne Milter, Project Director, Food and Security, Enhanced Resilience, GIZ India, Ms. Pradya Patnakar, SDG Manager, United Nations World Food Program, and Mr. John Peter Nelson, Executive Director, IGSS, for sharing with their important findings and through thought-provoking opinions in this program. A very big thank you to all the participants who have registered for this training program. Without you, the program would not be successful. I'm happy to express a vote of thanks to the organizing teams from NIDM for their tireless effort to make their program successful. And finally, my heartiest congratulations to Professor Anil Kumar Gupta, sir, for organizing this timely, important, and knowledge-gaining webinar. And with this, I would like to conclude today's vote of thanks. Thank you, one and all. Stay safe. Thank you.
Thanks to everyone, and thanks to Fatima for taking this initiative. Thank you, AD sir, for very summarizing.
Thank you to everyone.
Thank you. Thank you.
Thank you.
And thank you, Pradnya. Special thanks to Pradnya. And we can have a follow-up meeting to discuss the following actions. Yeah.
Sure. Thank you.
Thank you.